The Jane Aubrey House is a home for women who struggle with opiate addiction. I believe the way our country has approached opiate addiction and recovery has been a complete disaster. I know that individuals who struggle with this illness both deserve and need affordable, effective, long-term treatment. Jane Aubrey, she was my first child. I loved her before I even held her in my arms. I knew I was supposed to be her mom. We did everything together. In fact, in a lot of ways, we grew up together. She has the biggest blue eyes, the blondest hair, and the best smile. And she was always the life of the party. In fact, when she was young, I used to have to say quite often, "Inside voice, Janie," because she was loudly leading the room. However, when Janie hit middle school, she started to change. And what I thought was normal teenage angst was actually the onset of mental illness. And I had no idea. She and I did go through therapy through her adolescence, and it was a struggle. But Janie got better. When Jane was 18, she made a bold move to Los Angeles to pursue a career in acting and dance, which made sense because she was very talented, super theatrical, and she had danced for the Nevada Dance Academy for many years. And when Jane was in Los Angeles, she and I spoke on the phone all the time, sometimes several times a day. And after a few months, Janie wasn't sounding like Jane. And I wasn't sure what was going on, but my gut was telling me that she needed to come home to see a doctor. At 18 and a half, Jane was in fact diagnosed with a mental illness called borderline personality disorder. People who suffer from this mental illness also suffer from other mental disorders such as anxiety disorders, eating disorders, and mental disorders. They also sometimes tend to self-harm. They have substance abuse issues and suicidal thinking. Janie had them all. This was a tragic diagnosis for our entire family, and her dad and I took several mental health classes just to ensure that we could have as manageable, normal, loving relationship with her ongoing with this illness. I don't know when Janie started self-medicating, but she did. And I don't know when she started taking prescription pain pills, but she did, which led her down the really scary path of addiction to heroin. Her dad and I had her in several treatment recovery programs, none of which worked. She would go in for the typical 28, 30-day program, and this only didn't work for her, but it set her up for failure. 28, 30 days is the normal amount of time for someone who suffers from an addiction to get treatment, and it also sets them up for failure. By the time Janie was 21 years old, she was out of control. I cannot tell you how many times her dad and I were on the streets searching for her, busting her out from under, or getting her out from under dirty bathroom stall doors, or me going into a drug house, pulling her out, putting her back in our car, and taking her back to the very places that promote substance abuse program and mental health services, with them only turning her back out on the streets within 72 hours. And I was always there, and I would plead to these professionals, "What are you doing? My baby is sick. She needs long-term help. You need to help her." And they would just look at me as if their own hands were tied, with a super sad look in their eyes, knowing that we were losing the battle. On March 10th, 2015, at 3:40 in the afternoon, I got a phone call. And it's that phone call that no parent should get. Janie had overdosed on heroin, and I had lost my baby girl. And here I stand a short 22 months later, and my heart is broken, and I'm pissed off. I'm angry that I had to lose my daughter. I'm angry that no one could help her. And I'm angry that our substance abuse treatment programs and mental health services across this country are so broken. Which tells me that if we treated substance abuse as the chronic illness that it is, then we as a country would be approaching it in a much different way. The United States spends over $400 billion annually in the name of addiction on programs and resources that don't work. And this is exactly what happened to me and my family, and it's happened to many others across the United States. And it's unacceptable, and this is why we need to be having this conversation. Did you know opioid addiction is 1.5 times more prevalent than cancer, with only 10% getting treatment, only 10%. And this is both from prescription pain pills such as hydrocodone, OxyContin, Percocet, Vicodin, morphine, and then your street drug heroin. And what's interesting is that all these drugs, they produce the same effect in high. It's the same thing, which is why 4 out of 5 people who are addicted to heroin started out with prescription pain pills, moving on to the cheaper, more readily available street drug heroin. In November in 2016, the U.S. Surgeon General came out with extensive scientific evidence proving that opioid addiction is in fact a chronic illness. And this is because it changes the structure of your brain. It actually alters your brain. And in turn, this is why people who are addicted to opioids have a higher risk of chronic relapse, which is what happened to Jane. Since being involved in the recovery aspect, it's why I know that we need to have substance abuse programs widely available across the United States, because currently we don't. There is a huge shortage. And a lot of times it takes weeks, and sometimes it takes months to get into treatment. These are the things that I think we need. I think we need to have prevention early on. We need to have it in our schools, our educators. We need to have it in our local, state, and national legislative system to be committed to changing how we're approaching opioid addiction. We need to stop punishing people who have this addiction and start really helping them. And all doctors, every single physician needs to be really educated on the dangers of the addiction of prescription pain pills and opiates. And I also think it would be really cool if we could create a monitoring system that the medical community could tap into and collectively track when and if prescription pain pills are prescribed. After Janie died, I led the charge of a volunteer program addressing addiction with an emphasis on opioid addiction. And this brought awareness to my hometown. And in turn, it spurred a year-end initiative at my church to raise money to purchase a recovery home. And with the help of many volunteers and leaders in my community, I am really proud to say that in July of 2016, we opened up the Jane Aubrey House. This is a home to help young women between the ages of 18 and 25 who suffer from opiate addiction. And this is not your typical 28, 30-day program. This is a as long as it takes program to ensure that these women can really begin to heal. And they have intense They have intense access to therapy. They also have personal development, financial training, and job placement. It's an incredible program. And you can do this. Thank you. And you can do this in your community too. Reach out to your local leaders, reach out to your law enforcement or your church, and get together, get your resources together and your ideas together so you can make a difference in your community too. Because chances are the person you're sitting next to is struggling with an addiction. And if it's not them, then they know someone close to them that is. And addiction has no bias. It doesn't matter what your socioeconomic status is, or your race, or how well you've raised your children. And when we realize that we need to love those who struggle with this chronic illness until they can love themselves, that is when we will see a real change for us all. Thank you.